Hi, my name is Coleman Gulick. I'm going to be doing a physical assessment today. I've washed my hands already. Do you have any questions?
No.
Okay. And I've taken his vitals. His blood pressure is 173/74, heart rate of 78, and respirations of 14. I'm going to be assessing his mood and cognition and behavior throughout the exam. I'll start by looking at the head, which is normal cephalus, not misshapen. I'm going to examine the scalp for tenderness. I'll palpate it. I'll inspect it for dryness or redness. Nothing there. I'll palpate the supraspinous muscles, or paraspinous muscles. There's no tenderness. Do the trapezius muscles, no tenderness. I'll do the sternocleidomastoids. Everything's good. Okay. And then I'll start by having you smile. Okay, frown. Go ahead and raise your eyebrows up, puff your cheeks out. Okay, and that's facial nerve I'm examining. And then I'll go ahead and I'll press on your nostril here. Breathe in, breathe out. Okay, good. No congestion. I'm going to palpate, no tenderness. Nerves are symmetrical. Okay, and then I'll go ahead and examine the ears. We'll go from the lateral canthus. The upper part of the pinna is level with that. I'm going to palpate the pinna. Push on the tragus for tenderness. I'll palpate posterior auricular lymph node, any tenderness.
No.
Anterior lymph node, tenderness. Okay, I'm going to have you go ahead and plug your left ear. I'm going to whisper 3 words to you. Orange, banana. Go ahead and state those.
Apple, orange, banana.
Okay. Go ahead and plug that ear. Orange.
Orange, apple, banana.
Okay. That was the whisper test for the cranial nerve 8. I'm going to palpate the lymph nodes again. Anterior, posterior. I'll palpate the pinna and the tragus for tenderness. Inspect it for lesions in there. Okay. So now we'll go ahead and assess the eyes. I would start with a visual acuity test. I don't have a Snellen chart, but we can act like this is one. What I'd have him do is read the line that indicated vision for 20/20. He'd cover one eye, examine that. Cover the other eye, examine that from 14 inches away. I'm going to check the eyes for muscle symmetry and weakness. Okay, go ahead and look at my nose. Good. This is the cover test. Good. Okay. I'll just check the pupils for constriction. This is cranial nerve 2. Look right at my nose. Good. And they're about a 3 millimeter. Good. Okay, and then we'll do the corneal light reflex. Good. And then the red light reflex. Good. Okay. Now we'll examine cranial nerves 3, 4, and 6. Follow my finger. Okay, good. And then we'll examine the eyebrows for fullness and dryness, flakiness, which they look full and good. I'll go ahead and take a look at your mouth. I'll examine the gums and the teeth, make sure the gums color the teeth well, there's no redness or inflammation or bleeding. Go ahead and open your mouth up. So examine the teeth and the gums. Go ahead and say ah. It's cranial nerve 9 and 10, and then go ahead and stick your tongue out. It's cranial nerve 12, side to side. Okay, good. Okay, I'm going to palpate muscles of the jaw here. Go ahead and open, close. Go ahead and open, side to side. Okay, trigeminal nerve is intact for motor. Trigeminal nerve for sensory now. Go ahead and close your eyes. Tell me when you can feel me touch. Good. Okay. And the lips are a good coral color. I'm going to palpate for lymph node lymphadenopathy now in the posterior cervical, in the anterior cervical. Okay. Supraclavicular, infraclavicular. And we'll do the occipital. Okay. Alright, now I'm going to examine his chest, which is it's a 2-to-1 ratio. his sternum is not pigeon-chested, no funnel chest. And I'm going to go ahead and listen to your lung sounds. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay. I'm going to listen lateral now. Deep breath. Deep breath. Okay. Costovertebral angle. I'm going to palpate. Is that tender?
No.
Tenderness?
No.
Okay, good. I'm going to listen to the interior. Deep breath. Deep breath. Okay. I'll also note that the trachea is good in midline. And then I'm just going to check for symmetrical expansion. Go ahead and take a deep breath. Good. Okay, I'll have you go ahead and lie flat. I'm just going to listen to the heart sounds. Start with the aortic valve, second clavicular sternal border, pulmonic valve, second clavicular sternal border, or second intercostal, I'm sorry. Then we'll go to the Erb's point, third intercostal. Okay, I'm going to pull your shirt up here. We'll listen to the tricuspid, fifth intercostal. And then the mitral valve. And that was the diaphragm for the higher tones. We'll use the bell for the lower. I'm just going to listen to the carotid arteries. And then I'm going to palpate for any thrills at all three landmarks, or all five landmarks. We'll find the PMI, fifth intercostal. Okay, and then we're going to move to the abdomen. We'll go ahead and inspect first for any masses, asymmetry, color, which looks good. Then we'll auscultate. Okay, and we'll listen to aorta. And then the renals. Okay, and then we'll palpate in the superficially in the right upper quadrant, which will be the liver and the head of the pancreas and the gallbladder for any tenderness or masses. And we'll do the left upper quadrant, which will have the body of the pancreas and the spleen. This is the epigastric region. And then we'll palpate the left lower quadrant, which has the descending colon, which runs through the upper as well. We'll also note that this is a transverse colon there. and then the ascending on this side.